Well, again, I want to say thank you very much for those of you guys that are on. For those of you that don't know me, my name is Dr. Catherine Espana. I am a pediatrician in Houston, Texas. Currently still practicing pediatrics. I have my own practice, and I heard about this technology about 3 years ago, honestly, and ignored it for about a year. When someone called me and told me that, and I'll take it off because I think it's about time for me to take it off, that this little patch that literally looks like a sticker was doing biological things to the body, I told them they were crazy and there was no way that a sticker could actually do anything like that. And I literally ignored it without really looking into it. So I want to say thank you for logging in, for whoever invited you to this presentation, because at least you're taking the time to look into it, because I didn't even do that at the beginning until I started seeing what was doing with one of my really good friends' family. I trust her, and I was seeing it with my own eyes. And at that point, me and my husband, who's also a physician, said, "Okay, we really need to look into this because, like, we're noticing that my friend's mother-in-law had a very, very enlarged knee, very inflamed, was barely walking, was depressed because of all of it. And within 3 months after trying this, she was walking, her knee was looking better." And she wasn't really depressed anymore. She was literally like a different person. So that's when we started looking into it. And I've been now on this technology, my entire family, for about a year and 9 months now. And I can tell you that we all, I mean, both me and my husband say it all the time, we feel about 10 years younger. I used to be a ballerina before I was a doctor, and I have literally my knees are bone on bone. I have zero cartilage. And I had given up doing a lot of exercises that involved bending my knees because of pain. And I can tell you that now I am back in the gym. I'm doing squats. I'm even back in a ballet class, which I haven't done in years, thanks to specifically this technology. So I want to introduce you guys to Dr. Rachel real quick so she can tell us who she is and how she started using this, and then we'll get on with the presentation.
Thanks, Catherine. And so Catherine and I met actually through LifeWave. So another bonus. So my background, for those of you that don't know me, my name is Rachel Maurice, and I worked as an anesthesiologist in Canada for close to 20 years. I left in 2021, so it's been close to 4 years now. And in that time, not thinking I was going to be gone for very long, I started doing a lot of digging and learning because I had some extra time on my hands, not working, and started coming across information that was not taught in my medical school training. Very initially disturbing to me because it completely dismantled everything I had understood and had been taught in medicine. Not that it was completely incorrect, but that it was missing one of the most important points, and that is the fact that light is the driver of every single physiologic process in the body. And I started diving into this because it became very exciting, voraciously reading and absorbing everything I possibly could get my hands on. And that was for a good solid 2 years. And I started researching phototherapy because of this light component and ended up coming across these patches. The second person that I was introduced to them by, I knew her personally. I had known her for a year. And it was the changes that I saw in her that made me dive in and look deeper. I thought it was just another red light panel type of thing, which it's not. And we'll get into why that is. But the changes with her was timely because my mom's health was starting to decline to the point where her doctors were talking about heart surgery. And having spent 25 years in the operating room and everything that I had seen, I did not want my mom to have heart surgery, any kind of surgery, if she did not have to. And so we got involved. I was then subsequently reintroduced and signed up with a lady who was a cardiac surgical nurse for 20 years, Diane Hunt. And she showed me not just stories, but showed me investigations, echocardiograms, ECGs of people who had been in heart failure, significant and profound heart failure, no longer in heart failure after 8, 10, 12 months of wearing the patches. So I told my mom, we're going to get started, give it a year. I don't want to hear any complaints before a year that it's not working because the body takes time to heal. And to my surprise, within 2 weeks, she went from having to stop every 2 to 3 steps to catch her breath because we walk together all the time to walking 20 to 30 minutes with me on an incline while talking at the same time. Again, very shocking to me. Then 3 weeks after starting the patch, her doctor had to lower her thyroid medication she had been on for over 3 decades. Again, not something I was thinking about. But lots of things have happened since, and I can share more afterwards, but I will hand it back to Catherine so we can get on with the presentation.
Great. Thanks. So yes, you will hear a couple more testimonies from other people besides ours, but right now we're going to talk about what exactly is this, right? It is the power of the patch, the power to actually heal our bodies specifically. Disclaimer, this patch, it is not medication. We are both physicians, but we're not your doctors. This is not intended to diagnose or treat. We are just going to talk about how this device essentially gives our body what it needs so it works the best way. So do you guys remember when you were younger? You know, we had all the energy in the world. I feel like we want to like turn off our little like, 5-year-olds, 10-year-olds that no matter, even if they don't sleep, they're kind of running around like crazy. But now most of us feel like this guy. We lack energy, struggle to really stay active. You're feeling like our body isn't keeping up. And a lot of times, even doctors tell you that certain things, when you have aches and pains, they say it's part of just getting older. You say, I'm not in my 20s anymore. And it's funny because nowadays I feel like it starts, I'm in my 30s, my 40s, my 50s, my 60s. It doesn't matter what decade, you always have an excuse to say it's just because, I'm just getting older. But we're here to tell you that no, we don't really have to have that excuse. Imagine if you have something that could give you back that energy like when you were 20 that will help you think clearly because we have this mental fog. And that was one of the things that I noticed too with this patch fairly immediately. So I'm going through perimenopause and I would just forget everything. I would walk into a room and I would be like, why am I here? And I've noticed that the mental clarity with this, it's insane. Like I am way more focused at work. Also be able to move freely. Like I said, I'm able to exercise way better because that pain and that inflammation is just gone. And it really helps to reduce stress and you just enjoy calmer, more balanced life. I think nowadays, everybody in the world lives in this like, sympathetic go, 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 go state. And if you have something that sort of slows you down biologically, so you feel like you're more in control, that by itself, it's going to be better for your body. So how we talked about, we were talking about as you age, I said, by the age of 30, your healthy stem cells. And what are stem cells? Some people hear of the word stem cell because, right now it's kind of like in that you hear that people are getting injections of stem cells, whether it's for cancer, whether it's for any kind of immunological disease, or sometimes people are doing it just to get fit and healthier. But it is very expensive. It's also not 100% proven to work because it usually is not systemic. But when they inject stem cells, it's like for your knee or for your shoulder or for things very specific. And it is not your own, although they do autologous stem cells, is not the same thing when you're kind of injecting something back into you. But by the age of 30, these stem cells are the sort of the mother cells that tell all of your cells in your body what to do. So for example, I always use the example of a fracture. My 15-year-old son, God forbid, fractures his arm. We put a cast on him and, 4 to 6 weeks later, that fracture is healed. The cast didn't really heal the fracture. It was those stem cells that kind of got together and told the body that they needed to make more new bone cells in order to heal that fracture. If I, at the age of 47, tend to have the same fracture, God forbid, I don't, a lot of times we end up when you're older in the OR, in the operating room, with, some sort of steel or some sort of something on it to try to make sure that we fix that fracture because we know that our body is just not going to be able to heal as well. Or if they don't do anything like that, sometimes you end up with sequelae for the rest of your life where you don't use that arm very well or you have pain forever. And that is because these stem cells are not working very well. And unfortunately, by the age of 60, 90% of these stem cells are decreasing. So the fewer stem cells you have, the faster you age, the slower you heal. You can't really heal and come back from things as quickly as when you were younger. I always like to introduce Dr. David Smith, who is the inventor, the founder, a genius, in my opinion. If you don't know who he is, please write his name down, Google him, watch a YouTube video. You will be impressed. Your mind will be blown. He has over now actually 200 patents worldwide. And there's actually more than 80 clinical trials on this technology. So this is not something that was born yesterday. This company's been around for over 20 years, 21 years to be exact. I have a friend who lives in Denmark who I called super excited when I started using this and started noticing great things in my body. And she literally told me over the phone, girl, I've been wearing these for 10 years. So she has been using this technology for 10 years. I had no idea. So although this might be the first time you hear about this, this has been around the world for 21 years. Um, and the company went from a 20 million company to a 600 million company in the last 3 years. Why? Because the latest technology and the latest one that was invented is the X39, this one right here, which I call it the mother patch, meaning it's kind of like a multivitamin. There are in total, I think, 11 patches that he has come up with in the last 20 years. The last one being X39, which literally in my mind does what all the other patches does, combined into one little by little. And then we have other support patches that later on you can ask about if you need a little bit more support. But today we're going to be talking specifically about this one because I've noticed so much change simply with just this one easy technology. What is it? And what is it made of? So first of all, it is non-transdermal. What does that mean? It means that there's nothing that goes into your skin, nothing that goes into your body. Most people, when they think of the patch, of a patch, they think of like a nicotine patch, a lidocaine patch for pain, you know, patches that have medicine, a hormonal patch now, that are going to do whatever that medicine does into your body. The cool thing about this is that there is zero medicine in this. This little part in the middle, that little round part, it's simply just an organic lattice of nanocrystals. They're these little tiny crystals that act as a mirror. It turns out one of the things that they don't tell you in medical school, as Rachel said, that we actually all emit light. We are, um, light beams. We don't see it because our eyes are not capable of see that specific wavelength of light, but we are emitted essentially infrared light 24/7. They say up to 8 inches away from us. And that light, some people call it energy, some people call it aura, but essentially it is a wavelength of light. And this patch, all it does is that it acts as a mirror. So I know this is going to sound crazy because that's what I said at the beginning the first time I heard about this. And it sounds like science fiction, but it really is science. Is if you put this patch on, imagine we are emitting light that we can't see, and it really reflects off of these little crystals. And for lack of a better word, it injects back into our body and it gives the signal to our body to start producing a particular peptide that's called GHK copper peptide. We all have that peptide in our body, but as we age, just because we have less hormones, less cholesterol, sorry, less not cholesterol. I wish that we, just happen to have less cholesterol, less collagen is what I meant, that people hear about that. We also have less of this peptide. And this peptide, his job is to keep our inflammation down and to activate those stem cells, reactivate those dormant stem cells. So whenever this patch gives our body instructions, similar to like what the sun does, we all hear about the sun making vitamin D for our body. So what it does, it's not the sun, is that sunlight, that wavelength gets absorbed into our bodies. We all have receptors in our skin, and it gives our cells a signal to create vitamin D. This does the exact same thing. The sun tells our body, hey, you need to make vitamin D. This little patch tells our body, hey, you need to make this copper peptide. So it sounds a little crazy, but later on, Rachel will explain to you exactly how we use it. So the power of this peptide, they call it the holy grail of age reversal. This peptide was discovered in the 70s. There is thousands of studies, clinical studies talking particularly about this copper peptide and what it does into our body. And there are a lot of people that actually inject this peptide into our body every single day to help with it. But it's not the same when you're injecting, like I said, something coming from the outside than when your own body's producing it. It is much more strong and much more effective when it's your own body. And at the end of the result, what it's doing is it activating those stem cells that are dormant. So our body starts reversing in age, literally, to start acting like when you were younger. And so it starts giving you more of that energy. It starts actually those cells that are regenerating, like auto healing itself, giving our body that healing capacity to be able to go back to kind of where you were before. Like I said, this is science. There's lots of scientific evidence on this. This is one that I really like because it's very visual. This is a topographic map of a brain of a 77-year-old woman. When we see here, all of that red is a lot of inflammation. We tend to accumulate inflammation as we age, whether it's from stress, from toxins, from any kind of disease. And 3 weeks later, you see the inflammation, it's almost gone. And 6 weeks later, it's a complete turnaround. There is better brain coherence. The brain does not have inflammation, meaning that essentially, if our brain works better, the rest of our body is also going to work better. And this is where that mental clarity that I was talking about. So now I want to give a chance. I know Rachel has a couple of people that want to share what they have been feeling with this technology, people that have been wearing it. I don't know if they're around.
Yeah, maybe if you stop screen, can you stop screen sharing for while we do that and then get back to it? That would be great. Then I can see. Okay, we have Andia. I can see Andia there.
Hi, everyone. My name is Andia. I actually originally got this patch for my mom. She had polymyalgia and she was walking around like she was 100 years old. She wasn't in a wheelchair, but she had a significant pain in her legs, and they had her on 3 pills of prednisone, and that medication has a lot of side effects. And at the 6 month mark of wearing the X39 patch, my mom has no pain in her legs and she's off of her medication. And I started wearing the patch. I've struggled with quitting coffee and didn't have any caffeine withdrawal. So that was the first thing that happened. And then I didn't know I had brain fog, and I could feel that I did after it lifted. And that was about the 1 month mark. And then my eyesight has started to reverse, and I no longer have period cramps. So I had some hormone dysregulation that I've had my whole entire life. I used to take a lot of medication just to function normally so I could go to work because my cramps were so bad. And now I don't have them anymore. Um, there's a bunch of other stuff, hair fall and things like that. My mood is very stable. My motivation to work out in my 40s was literally gone, and I'm no stranger to working out. And that is also back. So, um, yeah, I want to have time for others to share. So those are the big things.
Thanks,
Thank you.
Andia. That's great. Thank you for sharing. And okay, we also have Paul. I think I did see Novak. Can you unmute yourself? No, is it no?
Yeah, he should be able to mute himself.
Yeah, I'm just looking to see what. Okay, there we are. Okay.
How are you, ladies? I'm Paul Nosak, and I recently became aware of this product at a convention in Las Vegas, and I had some really bad pain in this arm. I couldn't put my hand up like this. This is my left arm. My wrist watch is on it. I couldn't do anything. I felt like a crochet needle was in my elbow every time that I would do that. And so I let Elena give me a patch, and I put it on a Saturday. On Sunday, I went back and bought it because the pain was gone. It wasn't like drizzled away gone. It was all gone. And since then, I have taken pain medication for 2.5 decades from 15 major surgeries: hip replacement, double neck surgery, single neck surgery, bilateral shoulder, bicep tenesis, 3 knee operations, trauma on both wrists, double hernia, single hernia, Nissan fundoplication, LASIK, which that doesn't hurt much. I paid $15,000 for stem cell in both of my hips, and then I had PRP, and then I had they took the bone out of my hip and put it in my neck. That spot quit hurting. Long story short, I've hurt a lot, and for 22 years I've taken hydrocodone and then oxycodone. And when I met the team on the 22nd of August, I was taking 4 Percocet 7.5s a day. Right now, I haven't even finished Saturday's dose, and today is Tuesday, and I have cut back. I've gone through the withdrawal because I was dependent for so long, and I'm taking a half at nighttime to go to sleep, and I'll take a half about noon. And I'm using the bathroom more. I've cut back on my Cialis. I'm 55, and I have a lot of activity, and so from that, it's affecting me in a lot of ways. And the biggest thing is I've had a brain injury for 7 years since my daughter and I were in a horrible crash. And since then, I've not been able to remember concisely. I've had lots of tests done where they've blown air into my eyes, and they've done ear tests to see if I had a brain injury or if I had inner ear injury. They confirmed it wasn't inner ear. They made me dizzy with eye puffs. I've taken batteries of psychological tests to see if there was something in my body that was, confirming the brain injury. And so I have not been able to remember numbers and things like that. I'd go down to feed my cows, and I'd have to look at my watch 5 times to get through 1 minute with the feeder. And now I'm remembering full phone numbers. Today I had to call the electric company to get a disconnect on a property because I'm a contractor. I'm going up and down ladders. I'm going up and down scaffolding. I'm running the crane, and I'm up at 5 a.m. And right now it's 8:30 and I just got home from work. So the stuff is real. I gave it to my daughter to help her with her knee. And she's 24 and she was in the same wreck with me. She put it on and her knee quit hurting. I gave one to the airline attendant at the American Airlines terminal in Las Vegas. And she messaged me that night, my elbow didn't hurt all day, thanks to you. And it wasn't me, it's a miracle, it's God, because it's the energy and the divine invention that this man came up with. But at the same time, I have gone from 4 Percocets to 1, and I'm looking to get that full 1 gone. And I've been leaving it on for 24 hours. I'm really actually leaving it on until it falls off. And then the moment I leave, it falls off, I feel the pain. And I feel like there's something missing in me. And then I go as long as I can to let it do the reverse charge or whatever. And then I put 1 back on. So that's my story. And
thank you. Thank you. Thank you so much for sharing. That's amazing. And that's the reason why we're here. So I know we try to keep this to 30 minutes. Unfortunately, I think it's going to be a little longer because we have to figure out how this works. What are the benefits that Dr. Rachel's going to tell us? But these testimonies is the reason why I continue to do this. Although I'm still a practicing physician, people sometimes have told me I'm crazy and that, this is a hoax and it doesn't work. But no, this is for real. That's why we wanted to share that. So I'm going to go back to sharing the presentation. So Rachel can take over. I don't know where it went. Hold on. It's right there. There we go.
All right. Thanks, Catherine. Okay, so I'm just going to quickly touch on this because the patch uses the power of light. So phototherapy is not a new thing. The sun is the original phototherapy because that is what I said at the beginning. Light is the driver of all of our physiology in our body. It's only been in the last 3 decades or so that science has caught up with the understanding from a scientific standpoint in the body how this exactly works. And then we have marketed it and created things like red light panels. And so we call this stuff photobiomodulation. So really it's just a technical term for photo meaning light, bio meaning the body, and modulation meaning change. So changes within the body using light. And specifically, this term is found, there are 6,000 studies in PubMed with the term photobiomodulation. So people who say that it's not a real thing, they have not looked at the science, but it is all there for anyone that wants to go look. So the benefits of these patches using the light, these are only some of them. They help with reducing inflammation and pain. And inflammation is fundamental to almost all chronic diseases. So getting rid of inflammation can help you reverse symptoms, reverse diseases, and you can imagine how that feels. Reducing pain, at least half the population walks around with some type of chronic pain. We just heard 2 testimonials involving pain as well, and what that can lead to. So imagine eliminating the pain, eliminating all of those medications with all those horrible side effects. Improves strength, stamina, and energy levels, which who doesn't want that, even if you are not just low in that, but if you're an athlete wanting to take it to the next level. Improves muscle and bone density, which declines as we age. Improving mental clarity and reducing stress is a really big one because that can impact all areas of our life. If we don't have that mental clarity and we shy away from the connections that we have in our lives, then that dramatically reduces the quality of our life, balances hormones and eases anxiety that Catherine alluded to at the beginning. The same with me. That was one thing that I noticed, that especially just that even keel and that calm feeling improves hair growth and skin appearance. And I just want to elaborate a tiny bit on this. I know, mindful of time, but we think of this as just purely aesthetic. And while it is due to an increase in collagen, we look at the hair, the skin. Yes, we've got less wrinkles and tighter skin and less skin, the age spots, etc. Collagen is one of the most abundant proteins in the body, and it is extremely crucial for the communication that takes place in the body. And communication is key to our health because the cells need to be able to speak to each other, to know what's going on, and tell each other when to do what. And if that communication isn't there, our health breaks down. And so collagen is so important because it forms these nanotubules of water in the body. The collagen is part of our fascial network, which touches every single part of our body. Light travels through the water network in our body. So therefore, collagen, because it forms these water networks, is really crucial. And so I just wanted to make a point of emphasizing that. Promotes cellular repair and wound healing. And I've got an image which I can put up on the end at the end, which is amazing. One of my friends sent me a message. He cut his hand and decided to put a patch on. And 3 hours later, he said, I feel like Wolverine with how fast it was healed. Improves sleep quality. That's a really big one as well, because sleep is when our body repairs itself. So we could get the number of hours of sleep that we supposedly are supposed to get, but if we're not having the quality, then the repair that's supposed to take place won't happen, and we will continue to break down faster than repair. Next slide. Okay. And so as far as the long-term results here, within the first few days, over 4,000 genes begin to reset to a younger state. Now, you might not feel this, we probably won't feel this. We have 100,000 reactions going on in every cell every second of the day, and we don't feel that. But what this means to be reset to a younger state, I didn't understand that when I first heard it. And I thought, well, if I'm a medical doctor and I don't understand that, then I'm sure many other people don't. And so the way it was explained to me that I can relay it to you to understand is, let's say you're a photographer, professional photographer, and you create these beautiful photos and images depending on the lighting you have around the room and all the different equipment that you have. Well, when those pieces of equipment start to break down and some light bulbs go out and some get brighter, then you don't have as nice an image. So getting all of that lighting and all of those equipment pieces and the setting back to the right stage, then you have this beautiful image. So that is like our genes being reset to a younger state and expressing the health and protein in the way that we are supposed to. Within 6 weeks, the brain becomes more balanced. And what that means, again, is the left side of the brain and the right side of the brain are speaking to each other. And it's all about communication to express health. Within 3 months, collagen is increased, which I touched on earlier. And within 6 months, the heart reverses in age. And that's not just the heart, it's the whole cardiovascular system. So all of the blood vessels, the arteries, the veins, the capillaries, and everything, which affects the entire body. So I love how David Schmidt puts it. It's not anti-aging, it's age reversal. So how do we wear this? This is one of the things that I absolutely love about this because it is the simplest thing around. I know Catherine said she took hers off. I've got one on the back of my wrist. You can see it's really small. And it's simpler than brushing your teeth. You literally have a sticker, you take the backing off, you stick it on your body in the morning, you wear it for 12 hours, you take it off at night, or 12 hours later, sorry, and then you either can throw it away or you can do what I do, and I put that on my dog's collar and then I put it on her the next day because there's still a few hours left of activity in it. And the reason you only wear it for 12 hours a day is there is a reason, because we want to continue to respond to the stimulus. So if we are constantly being stimulated by something, just like we don't live under the sun 24 hours a day, the way I describe it to people is if you have your 5-year-old that's constantly bugging you and tapping you on the leg saying, you know, pay attention to me, pay attention, you start to ignore it after a while, right? At first it's annoying and then you just start to ignore it. So that's the same with your body. You want to be able to respond to that stimulus. So you need to give your body a break. Now, you want to put another patch on the next day, and you continue to do that. And the time frame, this is where everyone is different. The minimum, really, if people are going to try it, it is a minimum of 90 days because the research shows that 97% of people see an effect by 90 days. So if you say to me, oh, I'm just going to try it for a month, I will tell you to come back when you're ready to commit for at least 90 days because there's really no point in trying it for a month. The recommendation is actually a month for every decade that you've been alive on the planet. And you want to, that's to get your full reactivation of stem cells. But if you're anything like me, I am all about prevention. Again, I know I said this before, and I am going to harp on it. I spent 30 years in medicine and 30 years in the hospital setting. I do not ever want to go there if I don't have to. So I will do everything in my power to stay as healthy as possible. And for me, this is the most natural way of doing it because nothing is taken from outside and entering the body. And really it's so simple. Other things that are out there, you've got to take time out of your day. You've got to take energy. There's motivation. You might have to drive there. It takes a certain amount of time out of your day. Never mind to go there, but to actually do whatever it is. And this, it doesn't interfere with anything. You put it on, you go about your day, end of the day, you take it off. You want to make sure you drink lots of water, which I alluded to earlier with the collagen and how light travels in the body through the water network. But you want to make sure you add electrolytes to that water because you could drink 3 gallons of water and that water is going to go right through you into the toilet if you do not add electrolytes because that helps hold the water in the body. Now, you don't have to go buy powdered electrolytes. Some people like to do that. I have to do that for my daughter because she doesn't like putting salt in her water. So that is, to me, the simplest and cleanest way is unrefined salt. So it's got all of those minerals attached to it. So something like Redmond's real salt, Celtic sea salt, or Himalayan pink salt, again, unrefined because it's got all of those minerals there. And because this patch through works through increasing the copper peptide, we've got to make sure we have all the substances to make that copper peptide, including copper, which we didn't used to have to worry about because it just by eating a balanced diet, we would get it all. But with agricultural practices, we actually have to focus on getting copper in our diet. And so just a few examples at the top of the list, organ meats for everyone who I'm sure there are some people on here who actually like it. My mom does. I do not. But oysters are, again, a superfood all around, including getting copper, seafood, shellfish, avocados, nuts and seeds, in particular cashews and sunflower seeds. And then probably everyone's favorite, a small square of dark chocolate is adequate. And just for anyone who's interested, for myself, my kids, getting them to make sure they have adequate copper, I use desiccated organ meat supplements. So it's nice, it's bioavailable, there's no extra fillers, and they get everything else in there as well. And what to expect, this is another interesting one because everybody is different. Every body is different. So while we might start using the patches for a particular reason, we've got pain in our, let's say, wrist or elbow, or we've got headaches or period cramps or something else. The body has an intelligence, an innate intelligence, and it knows exactly what your body needs to heal first and in what priority. So some people might say, oh, it didn't work for me. But what they didn't say is, for example, my mom's friend who wanted to have his headaches disappear. After 9 weeks, he was no longer wearing his reading glasses, but his headaches were still there. So our body's not healing everything poof miraculously all at once. It's got to do it in sequence. It didn't happen overnight that we got sick. So we have to give it that time. So the longer you wear it, the more miracles you will experience. And we all have we came to this planet with a different set of genetic instructions. We've all had a different number of years on the planet, different toxic exposures, different traumas. So we are really all an N of one, which we talk about as subjects in a trial. So we are all individual. We can't generalize to everybody, except that it goes to work where it's needed. And sometimes you don't feel that. And I just want to emphasize that because so many people say, well, it didn't work on me. I didn't feel anything. And so I stopped. So I just heard recently on our team Zoom this past weekend, this is the second person that I heard who was in stage 3 kidney failure, wore the patches for 6 months, did not feel a thing, no longer in kidney failure after the 6 months. They did not feel that happening. Just like I said, we have so much going on in our bodies, we don't feel everything. So I just urge people to continue because your miracle will happen. If you are tired, that is a sign that it's working, because just like we have, everyone's probably got a cell phone, and when you've got a full battery in your cell phone, everything in the cell phone works. When you go down to low battery mode, it picks and chooses what is going to work and other things will not. Same with the body. So your body is saying we need to conserve the energy and put it towards healing. So honor the fatigue, give your body the rest, and allow it to do the work. So I will hand it back to
All right, great. So everybody now understands how do we use it. I think it's very, very easy. 12 hours on, 12 hours off. That's the first question everyone asks. And then the next question is, okay, how do I get it? So how do you get it? You're going to go back to the person that invited you to this presentation, because they are distributors and ambassadors of the brand. You have to make sure that you get it directly from the company. They do sell these patches on Amazon. They sell them on eBay. Now they sell them on Walmart, but specifically on Walmart, it's not Walmart selling them. It's actually people. Walmart has become kind of like an Amazon. So it's either people that are reselling it, and we don't know if those patches are expired, where they've been, how they took care of them, and they have no warranty. So I don't recommend that. Or they might be fake. So the ones at the ones at Walmart actually come with the Chinese stickers that made in China. These patches are not made in China. So just buy it directly from the company. That way you know, and you will have also a 30-day money back guarantee, and you know that they are going to work. So you can buy it as a retail customer, which is $150 for an envelope. There's 30 patches in every envelope. So essentially it's a 1 month supply. Or you can become what we call a preferred customer. So you get a distributor price, which is $99.95. You will have to have a membership, so they will sell it to you every month. So essentially you're buying it month to month. As Rachel says, she says minimum 90 days. I tell everyone the same thing. Please give it at least 3 months before you decide whether this is for you or not. And so you will just be buying it month to month. And then the other way that you can get this is that you can become a brand partner. And so you can become a distributor yourself, and you can buy one of these 3 different packages. So as a distributor, you can buy a package called a core patch, where you get 3 months for $295. It's perfect for a person that just wants to try it, wants to use it themselves. The advance, for me, it's perfect for a couple or 2 people that want to use it. You get 6 months of it, so 3 months and 3 months. And then the premium package is for a person that either has a very large family that wants grandma, mother, their dog, everybody else on them, or somebody that's like serious and says, you know what, I think I could share this and I could help other people as me and Rachel are doing it. Never in my lifetime I thought of this as a business. Again, I'm a pediatrician, I'm a doctor, I still practice medicine, but I think it's also very, very smart nowadays to diversify your incomes. I mean, I learned this after COVID. I had my practice, but if there were no patients coming because my practice was closed, then essentially there was no income coming either. So thankfully we had my husband who works, as a salary in the hospital, but that's also not 100% for sure, because, he works in a big hospital, and about a couple of months ago, they let go 1,200 employees. So you never know. And so I think it is very smart, and something I've learned, that we have some income from his salary, some income from us. We also, have some investment somewhere, and then we have this. And you've learned about the product, and in my opinion, with every great product also can be a great business if you decide to share it with others. You are blessing other people with this technology, and that's the way that I look at it. We heard from a few people, and in my opinion, I don't feel like I am selling anything, because essentially, although you are, because that is what a business does, you're actually helping others with their health. So they will feel so much better, as Paul that talked to us, and you maybe be able to get them off of horrible drugs that are just doing more damage to your body. And you might also be helping others with the finances, because I think nowadays our economy is all over the place. And I've learned this with a friend of mine, well, who's now a friend of mine, who called me. She found me on the internet, and she has a 25-year-old autistic child, not a child, I guess, anymore. He's 25, but for me, they're all kids since I'm a pediatrician. And it's crazy how we have changed this family's life. He was extremely aggressive, not sleeping, not eating. He would walk around naked because he wouldn't want anything on him. And it is complete 360 turnaround. But she said, I can't afford this technology. And I actually gifted her a couple of months worth it. I said, you've seen this changes. I have to help you. But then I said, you know what? I can help you even better if you share this with 4 or 5 of your friends. You can bless them and you can make enough money to pay for your own treatment. I can't do that with any medication in my practice. If somebody comes to me and says, I need diabetes medication, but I can't pay for it, unless I pay for it myself, and I wish eventually someday I will have enough money to open up a clinic and give these patches away to everyone. That is my dream, but I am not there yet. So I can teach them how to share it with a few people and help them through talks like this. And now she has been able to pay for those patches for almost a year herself. So to me, that's huge that I actually helped her to be able to, so her child keep using the treatment and the technology that was working, and it's keeping him with much better health. So to me, this is part of a purpose. This is part of a purpose that I think God put this technology in my hand to really help out just with what I do every day in my practice. But this, I can share it all over the world. I now have children. Obviously, I'm a pediatrician, so kids are very, close to me. But I have children using this technology in Australia, in Colombia, in Venezuela, in Houston, all over the US. This is in 85 different countries. So you can really touch people all over. So I know we've gone way over what I thought we wanted to do, but I want to encourage you guys to get back to the person that invited you here, whether you want to try the technology for yourself and you want to be a customer, or whether you want to share this with other people and you want to learn more about how we do this, we'll gladly share. So please just get back to the person that invited you here, because trust me, this is for real. This is something that, and there is a documentary coming pretty soon on Netflix. So everybody, I think it's going to hear about this in the next few months once this documentary comes out. So I hope you guys enjoy this. Does anybody have any immediate questions? I'm going to look at the chat real quick. I knew I like to. No, I don't see any questions. Yeah, somebody said, can we ask questions? Yes, I can't ever say no. I'm always here to try to help people. So if you have a question, you can put it in the chat or you can unmute yourself. We will gladly answer it.
Hey, Catherine, it's Christy Billings, your friend.
Hey.
I may have joined late. What's the name of the company?
The name of the company is called LifeWave. Life as in life, wave as in, waves. It's called LifeWave. That's the name of the company.
Thank you so much. I'm very interested in, so I'll get back with you.
Absolutely.
Thank you.
You're welcome. Who else said? Susanna, I think, had a question.
I'm just going to put in the chat a website for people as well that has the research, the scientific research, the patent testimonials, and a lot of videos, including with the inventor. So you can have a look at that if you're not familiar with it. It's got great resources.
Absolutely. So Sienna, the question that she said, is it FDA approved? No, it's not. But the reason it's not FDA approved because it's not a food and it's not a drug. So it doesn't need to be FDA approved. FDA only deals with food and drugs. It is FDA monitored, for you say, meaning that they do monitor what we do, just like they monitor all the supplements. So it is considered a wellness product, just like any other supplement or vitamin that you take. And so FDA recognized, there you go. I like that word. And they do essentially come every 2 years to see, the manufacturing, how it's going. And so, but it doesn't need to be approved because they don't necessarily deal with this type of product. Is it okay to put X39 on a pet after you remove your own patch that day? Yes. We talked about humans, but actually all mammals emit infrared light. So there's people using this on their dogs, on their cats, on their horses. And as Rachel said, when you take it off, there's still a little bit left, kind of battery left on there. So some people will put it on their pets after they take off theirs to not have to use a whole new one, and that's fine. Minimum age, there's no minimum age. There's no studies on kids. I don't think there will ever be studies on kids, just like with most things out there. People don't study kids or pregnant women for liability issues, but I can tell you that I've had babies using this that have, eczema, and has helped them with immune issues. I have a lot of kiddos in this spectrum that are using this, 2-year-olds, 4-year-olds, 6-year-olds, you name it. There's no medicine in it. So essentially, there's nothing that will harm them, which is what made me say yes as a doctor. It can only hurt them if it works. And what else is
Help them.
where do you suggest to put the patch every day for 90 days? I think Rachel kind of talked. We normally put it behind our neck, which is where I took it off, or underneath your belly button. Those are the 2 points that they recommend because that's where the studies were done. But this technology is essentially systemic. So really, wherever you put the patch, it's going to work because it's going to increase that peptide all over your body. And they do recommend it that if you have pain somewhere, like knee pain or shoulder pain, if you put it there, it kind of concentrates maybe there, and that's why it works a little faster. But for every day, if you don't have any pain, where the research was done was either behind your neck or below your belly button. And use your patches on plants as well. Yes, I've heard that too. I'm not a very much plant person. I don't have a green thumb, but yes, I've heard that people put it on their plants and it works really, really well. All right, so anything else, Rachel? I think we're good. Thank you so much for joining.
Yeah, there was one last question. How many patches can you use at one time? So really, if you added, for example, two of the patches, 2X39, they actually did the research and it only shows an increase in 20% of activity. So it's not really worthwhile. Having said that, some people still do that. And again, as Catherine mentioned, that this X39 patch was released in 2000, actually it was early 2020. So the company's over 20 years old. So there were other patches before that. You can use those ones in conjunction with the X39.
Absolutely. All right, perfect. And yes, you can use X39, 49, Eon, and SP6. Absolutely. You can. Believe it or not, there are some people that will put 4 to 5 to 6 patches on at a time. They all do their thing. They all do their thing differently. So talk to whoever invited you here. I don't recommend starting with 6 patches at a time. I recommend starting with X39. Get your body used to it. And then a month or 2 later, if you need something else, then you absolutely can. So all right. Thank you again. I hope you guys have a great evening. Thanks for spending this time with us and learning a little bit more about this technology. Bye, guys.